Diabetes is a serious disease that affects millions of Americans, and sadly, our older adult population is the most at risk. But the good news is, in many cases, diabetes can be controlled.
Yes, that is true. And here to help us understand how is Dr. Sundeep Singh from Healthcare Medical Partners. He's a primary care provider, as well as Dixon Keller from Humana. He's the sales and marketing director. Welcome to you both.
Well, thank you for having us.
Yes. So, doctor, let's start off by talking about diabetes. What can you help us understand about the disease?
Well, as you were saying earlier, diabetes is a chronic disease, and so as time goes on, your older patient population is more affected. So as our patients get older, we have a lot more patients kind of dealing with that. And then another statistic is Hispanics happen to be 2 times as more likely to actually have diabetes, according to the American Diabetes Association. So it's important to try to isolate who your main targets of patients will be and try to screen for it at least. Big important thing is diet and exercise, really maintaining a healthy diet. And it's hard to know sometimes what is healthy and what isn't healthy, and so we always provide information for our patients. And then a reasonable exercise program. It's always good to talk to your doctor before you start the exercise program. Many of my patients, I'll start them off slow and just work our way up to wherever they can get to.
Okay. Now, for our viewers watching who may have diabetes, what are some steps that they can take?
Important thing is regular interval checkups with your doctor. I think it's important to just keep an eye on things. We can do foot inspections, make sure the eye exams are okay. So that's a big one for me, is doing that. Regular checking of your blood sugars. It's important to monitor your levels, make sure they're not going high or low, and then based on those levels, we can readjust the medications. So it's important to do those things, and always check the instructions on your medications. Sometimes, you know, they'll have certain things and time intervals, so just due diligence is important for diabetes.
Yes. Now, Dixon, we're in an open enrollment period right now.
Absolutely.
Let's talk about seniors and Medicare. What's important right now for seniors?
Well, right now, open enrollment, it started October 15th and ends on December the 7th. And this is a time when seniors can make a change or enroll into a Medicare Advantage plan or a prescription drug plan. It's very important for seniors to look at different types of plans that are out there. We're talking about diabetes right now, and there are specific plans called special needs plans made just for people with diabetics, coronary artery disease, congestive heart failure, peripheral arterial disease, congestive heart failure, even end-stage renal disease. These are all plans that are engineered specifically to help the folks with those chronic conditions.
That's really important to know, because those chronic conditions are then considered special conditions.
Yes, they are.
In your healthcare plan?
Absolutely.
Okay, so you want to be sure you're on a plan that accounts for that.
Absolutely. Well, you want to make sure that plan is custom tailored just for you to help treat your specific needs. And Healthcare Partners has diabetes management programs for these patients. And Humana and Healthcare Partners work very closely together to help people really have great quality of life, to tackle those issues, because we want people to be healthy and happy and doing great.
Yeah, Dixon, I think that's really important. You talk about the customization. This can kind of be overwhelming, right? It can be a little daunting. You know, if you have diabetes, you're not sure what to do. And can you talk about that process a little bit?
Absolutely. But if you have good partners in healthcare, such as Healthcare Partners and Humana, working together as a team to help you get through preventative, to work with preventative medicine, to work with disease state programs such as diabetes management programs, getting you on the right drugs, affordable plans that will help you get, for example, diabetes monitoring supplies, giving you the education that you need. That's what the patients need. We help take that anxiety out of that mix for the patient, because we like our patients to be happy and healthy and doing great.
And we can't underestimate the importance also of a great primary care provider.
Oh, absolutely.
Like Dr. Singh right here.
Thank you.
Yes. Interesting. So where can people go if they have questions, you know, during this open enrollment period and are interested maybe in Healthcare Partners?
During open enrollment, people can go to seminars which are advertised in the newspaper, or you can call our 1-800 number that's on the screen.
Okay.
We make house calls. Humana representatives who are licensed representatives will actually come to see you and walk you through all the different plans that are available to you. You can also go to Medicare.gov, the website for the government, or you can go to the Healthcare Partners website, also listed on the screen, for a lot of information.
A lot of options there.
Lots of options.
All right, thank you, gentlemen.
Gentlemen, thank you so much.
Well, thank you for having us.
Yeah.
Open enrollment, it's going on now through December 7th. For more information, contact Healthcare Partners or Humana by calling the number on your screen or visiting the website openenrollmentnv.com. Healthcare Partners is also on Facebook and Twitter. We will be right back.